So I think for people that aren't that active, once they had a few experiences where they were like, oh, I felt really good after that because I felt so proud of myself. That sense of pride and achievement, that's what actually, encourages people to be active longer term and makes them come back. In terms of mental health, even going from no days a week to 1 day a week seems to have an increase in these great outcomes. And, as little as 20-minute walk improves mood as well. Two young mums are really busy and don't have a lot of time to catch up, but hey, we can take the kids for a walk around a park or something. That is physical activity. And if that's going to make you feel good, then, we shouldn't feel guilty about doing active behaviors that are good for us just because they're not a high intensity, or they're not in a gym, or they're not having someone yelling at you. If something is active to some degree and you're moving and it makes you feel good, then, that's a good thing.
Hello everyone, and welcome to today's episode of the Mental Wellbeing Show. In today's episode, we have Dr. Rhiannon White joining us. Dr. White is a lecturer in health and physical education and a researcher in all things exercise and mental health at the Western Sydney University. In today's episode, we discuss how to make exercise a sustainable habit in your lifestyle, what the different benefits of exercise are for your mental health, where and why exercise is being prescribed as a treatment for some mental illnesses, whether weights or cardio is better to unlock the mental health benefits of exercise, and much, much more. Now to today's deep dive with Dr. Rhiannon White.
Welcome to the Mental Wellbeing Show, where we take a deep dive into the wonderful worlds of psychology and mental wellbeing.
Thank you so much for making time today. I'm really keen for this one, given I've seen the benefit of exercise for my own mental health over a number of years. And I think it'll be the same for a lot of people listening that, they have an intuitive sense of how exercise can help them, but, they might feel good, feel better mood afterwards. But to really have a deep dive into what those benefits are, I think is a really cool opportunity. But to start, I wanted to actually put a quote to you by a former Chief Medical Officer in the UK, Sir Liam Donaldson. And the quote is, "The potential benefits of physical activity to health are huge. If a medication existed that had a similar effect, it would be regarded as a wonder drug or miracle cure." So as a researcher in exercise for mental health, what are your thoughts on that?
I always get quite have mixed feelings about the slogans around exercise as medicine, because I think it is exactly, that quote is 100% accurate. If there was something that you could package that had both physical health benefits and mental health benefits at the same time, it would be the most taken drug, and it would solve the most number of problems in one go, which is really fascinating. And when I first started this area of research around looking at the mental health benefits of physical activity, coming from a PE teaching background myself and being really interested in sport and physical activity, and I don't think there's a person on the planet that could really deny physical activity is good for physical health. But we don't need two different solutions. If it turns out physical activity can have these benefits for mental health at the same time, when we need to be encouraging people to be active for physical health as it is, then having both those benefits of one thing is a great way to look at health promotion and the prevention of disease in general. So I think that aspect of it is entirely accurate, and promoting multiple health benefits from one thing is fantastic. The part that's quite interesting, I find, is the framing of it around medicine. Physical activity is something that can be a really fun and interesting and enjoyable part of everyday life for some people, and kind of attributing it to, a physical activity is just something that prevents disease, or it's going to stop these bad things from happening, is an interesting terminology, because it does prevent these bad things from happening sometimes, but it also has all these other good things that are just add a lot to your life, as well as just preventing the bad stuff happening. So yeah, I completely agree with that, the value and potential of it being, one of the best drugs in the world, but referring to it as a drug and trying to reframe the messages around that it's not just about stopping the bad stuff, is a little bit of a challenge in terms of how we phrase that, I think.
That's so interesting. And are you getting at the fact that it's kind of the connotations about a medicine are that it's almost a necessity, it's a bit of a chore to take, whereas exercise, should be and can be looked at as a very different, more enjoyable kind of activity.
Yeah, and I think sometimes it can bring a little bit of guilt with it as well. Like if something you have to go to the doctors because something's not right or something's not okay, or and it kind of also brings with it, you might need a prescription, you might need something specific where someone's going to tell you you've got to do this many push-ups or you've got to run this many, the worse a disease is, it might be the higher dose of a drug, and it can kind of set people up to think like, oh, you know feel that little bit of guilt about, oh, I haven't been active enough, I'm now having like a doctor tell me that I need to do exercise to help me. And it does have a place in terms of exercise prescription and recommending things, but I think that side of it is okay as long as we do also sort of tackle that this is actually something that can make people feel good or that you can enjoy if we're recommending it in the right way, and not just kind of, a lot of people, I think, hear the word exercise and they've got this natural image in mind, and it might be, scarred from when they were younger, or it might be, a really bad image of when they used to go to the gym and they didn't like it. And so people will naturally hear the word exercise and they'll picture, potentially people that are inactive will often picture that one exercise that they really hate. And so it can feel like, yeah, you're being told you got to take this thing to fix yourself, which doesn't really set people up well to want to do something. It's, as simple as once you get told to do something, you don't want to do it anymore. It's as simple as being told to clean up when you're a kid. As soon as your parent says do something, it becomes a chore and it's this thing that you don't want to do anymore. So there's a lot of merit to it, but I think we need to do a lot more work to kind of think about how we phrase that messaging in the general public so that it doesn't sound like a chore, and instead it sounds like something that could be really enjoyable or that could make you feel better, and it's something that you get to have a bit of ownership over and not just something that the doctor tells you got to do.
That's such an important point, I think, because we'll get into the weeds of why exercise is so beneficial, but obviously there are a myriad of benefits, but I think it's about unlocking the unlocking and framing it in a way such that people can actually use and utilize and optimize those benefits in their own life, right? There's no point having this amazing drug cure strategy if people aren't actually doing it consistently, right?
Yeah, exactly. And that connects back to the world of research around drug adherence, and there's all these studies about how do we we know that this tablet is beneficial, but what about people who can't swallow the tablet or are so unwell that they're not able to do it? And so all of that world around how do we make sure people do stick to their medication in these kind of ways. You're exactly right that physical activity has huge benefits, but it's not going to benefit the people who aren't doing it. So how do we actually package that in a way where people are actually able to actually unlock those benefits from taking that medicine or engaging in that healthy behavior?
So on those benefits which you've looked at quite extensively, what are some of the mental health benefits of physical activity and exercise?
One of the great things about physical activity, you already mentioned before that it's good for physical health and it's good for mental health too. In terms of the mental health part specifically, what's so great about it is that we've got a heap of research showing that physical activity is associated with less depression, anxiety, psychological stress. So it's associated with less of, the bad things, but it doesn't just prevent, mental illness, or doesn't help alleviate symptoms of these mental health disorders for people who might experience those sort of symptoms on an everyday basis, or whether it's every now and then. But there's also a ton of research sort of showing that people in general who are more active within their week tend to have higher levels of vitality, which is sort of that more energetic feeling, really awake and alive kind of feeling of mood, as well as things like happiness and things like life satisfaction and more meaning in their daily lives and things like that. So I think that's one of the great things about it, is that we know it can help reduce and prevent those sort of negative symptoms, but it can actually also help boost some of these other good positive mental health and well-being experiences. And the extra layer on top of that is that physical activity is never going to be able to completely resolve all mental health disorders that that occur in the world. Some of them are genetics play a role for sure. Some of them are, things that happen in our daily lives that, physical activity can't prevent bad things from happening that might cause anxiety or that might cause grief for someone. But it can help to sort of reduce those symptoms. But the other value is that by increasing mood and self-esteem and positive well-being, that in and of itself can sort of help prevent future onset of depression and anxiety and those types of things too. So by focusing on that good mental health and how we can use physical activity to build that up in people, that can then also, as a result, help prevent those other negative things, reoccurring or coming back down the track.
That's so important so it's a preventative tool for people that don't have a mental illness, or some people, not everyone, but also it can be used as a therapeutic tool for some people, again, who have a mental illness.
Yeah, and I think that connects quite nicely back to that quote at the beginning that, there's drugs out there to prevent things, or, there's healthy behaviors out there that can prevent, disease or poor, health of some kind. And then there's, treatments out there to reduce symptoms. And then there's other things that you do to cure something. But the fact that when it comes to mental health, physical activity plays a little bit of a role in all of those spaces. It's probably what makes it such a universal kind of behavior that is good for everyone in all of these different angles, which is really cool.
So in the way of mental illnesses then, what are some of the mental illnesses that exercise is being prescribed or used to treat?
This is an area that's probably picked up quite a lot just over the last couple of years. There's a fair bit of research, not personally done by me as much, but a few colleagues are doing research in the sort of more severe mental health space. So people in mental health care settings where research is being done, where exercise physiologists are being brought in and, running X number of exercise sessions across a week is sort of part of that overall mental health care for these people. And, it obviously involves treatment such as medications and psychological support as well. But exercise is starting to become more common where it is a part of that bigger picture. So it's not the only part, but it is a recognized part. And so we're starting to see, exercise physiologists being brought into that, mental health care setting sort of area a little bit more. We're also probably seeing the flip side of that, where we're starting to see there's a bit of research with psychologists and doing interviews with clinical psychologists about their receptibility to actually recommending to their clients to do physical activity of some description. And so we are sort of starting to see it come from both angles, that exercise physiologists are being brought into mental health care setting, but psychologists are also sort of reaching out to the physical activity world where they're kind of saying, we understand that this behavior has benefits. 10 years ago, there was still a bit of, does it really have that kind of value, where we've got enough research now to know that physical activity does have benefits. And the fact that, people working in a capacity where they're engaging with people, whether it's, like lower, sort of less severe symptoms of depression and anxiety through psychologist appointments or counselors in schools and things like that. So we've got people from every angle that are receptive to getting this message out there or recommending exercise in a way. We just need to do a bit more to unpack what that ideal exercise actually is. But at the moment, I think that the fact that it's being brought in the more severe mental health clinical settings is really cool. But we've probably got a fair bit more work to do to actually get it brought into those more general everyday mental health promotion settings, whether it's, counsellors in schools and workplaces and those kind of things.
Yeah, so when you say that we've got a bit more work to do you think it'd be beneficial to have more? I know we kind of just talked about exercise as medicine and some of the problems with that, but would it help, particularly from, say, a psychologist's point of view, to have more of these kind of prescriptive guidelines as to what that looks like? Because I can imagine, as a clinician myself, like that really holding me back as to not knowing the dosage parameters or not knowing, exactly what I should be prescribing, what type of exercise, for example. So do you think that training, mental health clinicians on that is kind of the next step?
Yeah, definitely. You're spot on there. It's a really interesting area, and being a physical activity researcher myself, I look at how much of my every year for a number of years now that I'm spending trying to work out this kind of stuff, and then it's very easy to sort of then take that step back and think, okay, but, people who are working in clinical psychology, they have a huge role to play in terms of improving mental health and, reducing symptoms and preventing mental health disorders among the general population or, across all people. And they've got a wealth of knowledge in psychology, but they don't have that physical activity background. And so translating the findings that we're coming up with kind of to not just stay in the physical activity world, but getting those through to, psychology world as well, so that exactly people like you are in that position where you're not sitting there questioning, you don't feel comfortable recommending something to someone until we can give you that kind of guidance around what you might say. And it's quite interesting because I think that's when I first started this area of research, that's exactly where the point I started from. I was in a really fortunate position when I started research where, my supervisor said to me, what do you want to do? And I was fascinated by this idea that we could use physical activity for physical health and mental health. That's where I sort of started from. But I remember doing, someone who was in a research position every day, reading literature, reading everything we knew on physical activity and mental health. And I remember sitting there going, okay, this is really, really cool. We know exercise is good for mental health, but we got no idea where and when and who and how. And these are the things that we need to sort of learn a bit more about and make sure they're the things that we do send through to clinical psychologists in simple guidelines and things like that, so that people like yourself aren't sitting there going, okay, we know this medicine is amazing, but how do we get people to do it? Or what particular dose or type or, brand of this drug is it that we need to get people engaged in? So that's definitely where we're heading, at the moment in terms of better understanding exercise and mental health for sure.
I'm excited for the future of exercise in mental health, because there does seem like there's such potential. And I think even in some countries like in the UK with their NICE guidelines, which is like the kind of national best practice guidelines for healthcare, that exercise is now being recommended as an adjunctive or additional treatment for mild to moderate depression. I don't know if there are, you might know, but I don't know if there are any recommendations for Australian, national health guidelines, but it seems like more and more exercise is being recognized, on these kind of official or best practice levels.
Yeah, that's definitely been the shift over the last few years, actually integrating exercise, as you said then, as, not an alternative to these other things, but as this extra part of mental health care, whether it's in guidelines or in these sort of more clinical settings. So that's definitely the direction we've gone over the last little while. I think one of the areas that we need to do a bit better in is around the actual physical activity guidelines that we have. So we have these clinical overall health guidelines for mental health, which acknowledges the benefit of physical activity. But I think it's really easy to forget that, a few decades ago, physical activity itself wasn't promoted as this great behavior to engage in. It wasn't really until sort of 50 or so years ago that obesity became a problem that we really started to care about physical activity. So, previously exercise was just this thing that athletes did, or this thing that some people went to the gym and did. And it was only once we sort of realized, physical activity actually has benefits for every human being, not just those who are in this athlete setting or need to be performing at their max physiologically, that exercise has benefits for everyone. And then so we actually have far more research on the physical health benefits of physical activity than we do the mental health benefits. And that's just natural out of where that research has come from, that more athlete sport basis originally. And so we've got these great guidelines that tell us, how many minutes, as you said before, about, being a clinical psychologist, what dose do we actually prescribe to our clients? We've got these great guidelines that tell us, what intensity and how many minutes and how many times a week we should be active. But those guidelines are based on decades of physical activity and physical health research. The mental health benefits are sort of just starting to catch up over the last few years now. And so we can look at tailoring these physical activity guidelines to sort of focus on mental health a bit more. Or the other way we can go is exactly as you said before, okay, we've acknowledged that this is the best dose of physical activity for physical health, but let's start to kind of create some separate guidelines that can be used in psychology settings or used by school counsellors or used in mental health care practice, that they don't replace the physical activity recommendations we currently have around physical health, because physical health is always going to be important for everyone with or without a mental health disorder. So that's not to negate those, but starting to develop something that's a little bit clearer and a little bit more specific for people that are in this position where they're able to actually recommend physical activity specifically for mental health purposes. I think that's definitely something we need to do.
So, given it is, recommended in so many of these best practice kind of guidelines now, and we know, you've looked at a lot of the research looking at that it does have an effect on some mental health outcomes. Why is it so beneficial? What are some of the mechanisms underlying physical activity and its benefits for our mental health?
Yeah, so I find this question so fascinating because doing what I do, I talk to a lot of people within the research world, but I love when you're scrolling through Instagram or Facebook and there's sort of a random post by something that's not research based, but it's about physical activity being good. And I always find it fascinating scrolling through the comments to see everyday people, what their perception is around this, because it has changed a lot over the years. And a couple of years back, there was sort of a win free tickets to something post on Facebook about tell us why you do exercise. And I remember scrolling through the reasons, and there were all these comments. It makes me feel good. It makes me happy. It's fun. It's my favorite bit of the day. And I remember that particular moment for me was a real like, okay, this has actually gotten out of research world into the everyday world, in that, people are recognizing they do physical activity because it makes them feel good, which they're not just doing it to prevent obesity or to prevent diabetes. They're actually doing it because it makes them feel good, which is really cool. But if you dive a bit deeper and sort of ask people why, we've done this through a couple of qualitative studies where we do interviews with people about how they feel when they're active. And it always makes you smile because it's good that people are recognizing the mental health benefits, but it's always interesting to hear people say like, oh, it boosts my serotonin. And I think, how do you know it boosts your serotonin? Like when I'm doing sort of the other side of research where I'm talking to them, but how does it make you feel? You can't feel serotonin. And they're like, oh no, it makes me feel good about myself. And I'm like, okay. So there are definitely physiological and neurological pathways as to why physical activity is good for mental health. And physically, physical activity is a movement behavior. It does get your body moving. It does do things to your heart rate, to your breathing. It does change those physiological mechanisms around endorphins and serotonin and things like that. And I think that's initially the field itself what they focused on quite a few years ago in terms of trying to understand why exercise was good. And, exercise being a physiological behavior, we kind of assumed there was a physiological reason why it was good for mental health. So it's not at all to say that those things don't play a role to some degree. They definitely do. And they might play a role more so in that sort of vitality as an outcome. For example, subjective vitality is feeling really awake and happy and energetic and good. And that's a great feeling, and it's a huge part of mental health. But it's probably likely that the physiological mechanisms are influencing that, maybe more so than confidence, for example. So, we hear from people all the time that, exercise gives me that sense of confidence, makes me feel good about who I am. And it doesn't really make sense that, some molecule within that side of our body or our increased heart rate or something like that is what's making people feel confident or good about themselves and having higher self-esteem. So more recently, we've started looking at other psychological mechanisms. So what is it about physical activity that does make people feel good? And so some of those mechanisms are things like social interaction. If people are active with other people, having that social interaction can boost people's mood or mental health or well-being. Another hypothesis around that, like why physical activity is good, another mechanism is a distraction. So, for something like stress, perhaps, physical activity can provide you with a distraction from thinking about whatever it is that might be contributing to anxious thoughts or stress. And the other one is around that self-esteem. So physical activity for some people can give you an experience where you are able to achieve things, or you're able to improve your ability at something, or, you learn a new skill or a new exercise, and that sense of mastery that people get can make, people feel more confident or feel happier and feel pride and feel all these other kind of good emotions that come from physical activity. And so the physiological and the neurological pathways are part of the picture. But I think what's most important in terms of advancing the field a bit more so that we can get to the point where we're able to give psychologists these guidelines around how to recommend or prescribe physical activity, is that, I suppose, for me, I think the easiest way to explain it is that if it was only the physiological pathways, they were the only thing playing a role, then, if we had 10 people and they all walked for 60 minutes at the same rate or the same intensity or same speed, and they all had exactly that same outcome for mental health. But what we know is that, if we sent someone off to go walk around a work site for an hour as part of their job, someone walk around the block with their dog for an hour, or someone walking on a treadmill in a gym with their best friend for an hour, or walking around a river with a coffee, we could set these 10 people up in 10 very different environments or contexts and make sure that they all walk the same many minutes or the same intensity. And if it was only physiological reasons why exercise was good, then we'd see exactly the same outcome. They'd all report the same level of improvement. But we know that's not the case. We know that people get different benefits from different ways of doing physical activity. So I think that's kind of the clear part for us in terms of moving forward. Okay, how do we kind of really start to unpack this and figure out when and where exercise is actually best? Because all movement is going to be good for people, but it's possible that movement in different ways is going to be better than some other ways. And I think that comes back to those psychological mechanisms as opposed to the physiological ones. They'll always be there, but how can we use those psychological mechanisms to actually sort of optimize those benefits that we do get from mental health beyond just the neurological pathways that exist within inside of us all?
So you mentioned something there on the neurobiological mechanisms, I think it was endorphins. So is that something we see like kind of consistently in the literature? Because you hear about it all the time, exercise boosts your endorphins, runner's high and whatnot, but going through the literature, it painted a bit more of a gray picture rather than black and white of yes, it always does. So yeah, what does the actual research say on exercise and the relationship between that and endorphins?
You're exactly right. It is a grey area, and I think that's when I started in this area, that's where I was reading and I was going, okay, there's all these pathways, there's all these potential mechanisms, but we've never really been able to get enough evidence to really fully prove any of them. And so I guess that's what I meant when I said before that, it's not to negate any of that stuff. Your body does physiologically respond to movement in ways, and but there's never been enough research that really goes, okay, people have increased their activity level, we've seen higher spikes in endorphins, then they've had like less depression, or we've never had the right or enough studies to really be able to prove that that's what's happening. And so I think some of that language is sort of seeped out into, as you said, everyone hears it. You hear these words like endorphins and serotonin and people go, oh yeah, that's why I feel good. And I think that's where the field started, 20 years ago. That's what most of the literature focused on. So it's still someone like yourself who's searching through that literature. You're finding stuff on these neurological pathways. And there's little snippets of evidence here and there that are showing, yeah, that might be it, that might be it. But we've never had enough concrete evidence to go like, yes, that is why physical activity leads to better mental health. And I think for me, the interesting part is that, rather than putting all of our energy into trying to understand whether these couple of specific things inside are what is the main mechanism, at the end of the day, there's not much that we can really do to alter those. It's something that happens within inside us. We can't really prescribe exercise in a way that's going to guarantee more endorphins, for example, even if that was the main reason. Whereas if we start to understand, things like the social interaction or the sense of mastery that people get from exercise, well, we can kind of actually alter those things so that we can give people guidance around, okay, this activity might increase this sense of mastery more. So if that's the mechanism that leads to confidence, then we can actually do something with that. We can actually change the way that that personal trainers are delivering messages to make people feel more confident, for example. So, rather than kind of keep attacking this one area that we haven't really fully been able to have concrete evidence on, this other way of looking at physical activity is actually going to enable us to actually harness physical activity in a way that we're, giving personal trainers, coaches, PE teachers, psychologists, exercise physiologists, we can actually give them something that you can actually manipulate or work with to like increase these benefits for people, which is really, really cool.
And I think that's so relevant, because I think a lot of people listening, that'll be the main takeaway they're looking for from today's conversation as well, is, okay, if I am exercising, how can I kind of optimize and harness that, like you said, harness the benefits of exercise for mental health. And yeah, I want to dive into some of those variables in a second. But going back, you mentioned something, you saw something on a Facebook page, and that got me thinking, as a researcher, how do you feel about like seeing all these kind of, influencers promoting, exercise in ways that are, they're promoting exercise, which I suppose I feel like is a good thing, and I'm interested to get your take. But perhaps they're not staying strict to what the literature says, or they're being a bit sensationalist with what some of the benefits are. So what are your thoughts? I'm very curious.
It's probably mixed again, in a similar way to that quote in terms of exercise being medicine. There's some great value to it, but then there's also a few things that make you go, oh, I'm not sure. So you're exactly right. The fact that physical activity is this thing that is viewed by a lot of people as really good, and there are a lot of people out there that are extremely passionate about how good it is, and the more people are happy, to share those stories on their Instagram stories and say, that this is what physical activity did for me, that is a good thing, because it's starting to, as you said before, like it's seeping out into the real world where we know physical activity can make people feel good. I think the problem with the influencer sort of world is that we're not maybe doing it in a really evidence-based way, in that someone will kind of, the exercise they like, that might be what made them feel really good because they liked that one, and that's fantastic. But just because that was, the particular behavior that worked really well for them, it doesn't mean that that's the best activity for everyone. So, if someone's, been in a high intensity interval training environment, or they've done a certain group class and that's made them feel really good and they've enjoyed it and they've kept going, so they've lost weight and they've, felt better about themselves, then that is incredible. But the problem, I think, is when we get a tad too preachy and we start telling people you should do this because it worked for me, because it just produces that feeling of guilt again. And especially in the Instagram world where, a lot of the people who are sharing these messages, in expensive active wear with, a certain physique or a certain image about them. And, for the people who haven't done exercise in a decade and don't know where to start, who might have really severe depression or may just not have enough self-esteem or confidence to even walk into a gym. I think it's the image that comes out with that type of language on social media. It's great to make physical activity seem, like this good thing, but we also need to make sure that we're making it sound feasible and we're giving people a little bit of a choice over what they do, rather than kind of, this worked for me, it'll work for you too, because that might not really be setting people up for the best experience possible. And, it might be all about promoting one type of behavior that, might be great, but not necessarily the most optimal behavior for everybody. So I think we need a little bit more balance, I suppose, in the type of language that we're using on social media. But, that is a hard area to battle with, because it's, there's a lot of good merit and there's a lot of good value of what we can do with it, but it's not typically always, evidence-based, as you said.
Yeah, and on that note, you've mentioned a few times, or I don't think you've used the exact words, but the theme that has come up for me is this notion of individual differences, that some things may work better for some people. So on that note, is exercise ever detrimental or can it ever be detrimental for one's mental health?
Yeah, so I think it can be, and not to the extent where, people listening should kind of hear that and go, oh, okay, well, sometimes it's not good, so, I won't think about doing it. The benefits far outweigh the negatives. And I think what's great with looking at mental health outcomes is that, if we start to understand where the potential negatives might come from, we can easily avoid those parts and, pick an activity where we're not going to get those. And then that way we're really maximizing our benefit and we're only getting the good bits. So just like, physical activity and physical health, it leads to so many good improvements in physical health. But there is always a potential risk of injury or something bad happening. I think looking at it that way, it's exactly the same for mental health. So we have all these great benefits, but we know that not every behavior is going to lead to those benefits. The only real time where I think it can lead to benefits, it can lead to kind of no benefit, which isn't the end of the world because it's still a good behavior for us to do. But the only time when it actually leads to something negative is typically when people feel bad about themselves for some reason. And the only real times where that seems to happen is if someone's being told to do an exercise that they're not capable of doing, or if they're in an environment where they just themselves feel a bit self-conscious about the fact that other people are better than them. That seems to be the only real time where those negative outcomes actually come out. And so doing a lot of qualitative research in this area where we're not just measuring outcomes and measuring types of behavior, but we're actually talking in depth to people about where do you do this and who do you do it with and how do you feel while you're in that environment and how do you feel after exercise. We've been able to kind of map out, the good experiences compared to those negative ones. And those negative experiences around physical activity and mental health are so much fewer than the positive benefits, which is great. But the ones that are coming out as negative, it really does come back to that level of competence or the level of, individual ability. And so that doesn't mean that, that group classes are bad for everybody. Some people love that social dynamic and that's great. But, if we're talking about people recommending exercise or, psychologists talking to clients and things like that, then we don't really want people recommending, too high a target or doing an activity that's, that they may feel a little bit intense about in terms of their ability to do that behavior. And so we use the phrase kind of small steps a lot in terms of getting people into a behavior physically, in terms of progressing things from a personal trainer sort of perspective. But we kind of need to do that to some degree in terms of those mental health benefits as well, so that we're not throwing people in the deep end where they're going to feel bad about themselves, because it probably comes back to, even those physiological and neurological mechanisms we were talking about before. Even if those things happen, and even if on the inside great things are happening to our body when we're moving, but someone's making us feel bad about ourselves, or we just feel embarrassed or self-conscious, then those, embarrassment or feeling self-conscious, those emotions, they're really strong emotions and they can make people feel really not great, and that can really override the good value of physical activity. So we only see this stuff come out in social environments, which is a shame because you get a lot of benefit from social interaction, but things like going to the gym or having a trainer that's very expects everyone to reach the same target, and having group goals where 90% of the people in that class might be able to reach that goal, but the new person who's never done this class before isn't able to reach that goal. Making sure that we're giving people a little bit of choice and a little bit of feeling comfortable with where they're at, just so that we don't have those negative impacts on people's kind of embarrassment and self-consciousness and those types of emotions, because they unfortunately hold a lot of value and they can really kind of prevent people from doing physical activity longer term, and they can really kind of undo that value of physical activity, which is a shame. But also, they're things that are adaptable and modifiable, and we can work with it the more we understand this stuff.
What you're saying is bringing to mind a conversation I had with, I think, a co-author of yours, Professor Nikos Doumanis, where for the first time ever I'd heard about no pain, no gain, that mentality from a trainer's point of view, or even from someone who exercises themselves, actually being negative. And he did like this pilot study in Western Australia, and they kind of like had two groups. One group was more of they had the trainer instructor who was more of a no pain, no gain, push, do as much as you can type thing. And the other was not necessarily like letting them off, but it was just a lot more supportive and nurturing. And they saw, I can't remember the exact outcomes, but I think it was like exercise adherence and intention to continue with the program. And it was a lot higher in the supportive group rather than the no pain, no gain. So it kind of speaks to that element of controlling people and making them feel bad about themselves. Yeah, isn't great in the long term for consistency and adherence.
Yeah, and it's really interesting because there's a lot of research in that area around like a controlling communication style and what we call an autonomy supportive style. And we've had research in this area for a really long time, looking at motivation and looking at adherence to physical activity. So what I'm sort of starting to work on at the moment is looking at that, but in relation to those mental health outcomes, because we know that the more supportive styles increase motivation, increase people's likeliness to continue a behavior, which is important because otherwise they're not going to continue the behavior to get the mental health benefits. But also looking at how that supportive style can actually make people feel more comfortable and confident, and therefore have this higher sense of pride and happiness after exercise sessions. So that's one thing that we were working on last year, having this very similar to what Nikos has done previously with, maybe a 10-week physical activity program, but actually measuring mood after each session and looking at how supported they felt within the session and how that influences mood after exercise. And we've still got a lot of work to do on that particular project to analyze all those findings, because that was only at the ends of last year. But the interviews with participants after, it was really interesting, because a lot of people would say things around, they were saying to me kind of that, like, compared to this other exercise class that I do, sort of a more generic one that I do every week, I don't get yelled at this one. And I was like, in my world, that's great. Like, I'm a physical activity researcher about making people, be happy and enjoy exercise and improve mental health. And I'm like, that's great. Like, that's specifically, we were making sure we weren't yelling at people, but also it makes me realize how much that no pain, no gain message is out there. And for some people, it's great, but it's not necessary to have to do that to feel good. You can feel good without it. And so a lot of what I spoke to people about in these interviews, and I waited for them to bring up that, like, oh, no one yelled at me, like, no one judged me if I couldn't do 10 push-ups. If I did 9, I still felt good about myself. Whereas when I go to the other class, if I don't do 10, I don't feel good. I get no benefit. Whereas in this one, I felt good because I only did 9, but I actually did 9. And so having these kind of chats with people, and some of the others that were involved in this program that had a longer physical activity background and did exercise classes every week. And I said to these people, I said, by being more supported and getting options, I think that's a really key thing, is giving people choices. Human beings want to be challenged. We want to feel like we're capable of doing things. Every single human being has that desire to some degree to feel that sense of mastery, or feel like we're capable of doing good things. So if, from a personal trainer sort of perspective, or that kind of no pain, no gain message, if you give people, an option between 2 activities, or an option between 2 levels of an activity, or, you pick the order that you do these couple of exercises in, people will still pick something that is challenging enough for them, because they want to feel great and they want to feel like they met that challenge. But what it does is it tones down that, if you don't hit 10, you're not good enough. And therefore, if someone gets 5, they feel great. If someone gets 10, they feel great too. If someone gets 12, cool, they feel good too. So you're not kind of, preventing one person in the class from feeling good by, like, having a target that suits the other 9. So Nikos's work that he's done around motivation and around physical activity, and the supportive communication style versus the you must do this many and you must do it in this many minutes sort of style. There's a lot of benefits to that for long-term physical activity. But that's sort of what I'm starting to look at the moment, in terms of how do we harness that side of things in terms of mental health as well, because the qualitative stuff that I've done over the last couple of years, you read these quotes from people and they're saying, like, the time when I felt great after exercise was when, it was the first time I did a higher number of reps. So people still need to feel great, like need to try things, and then acknowledging that when they did something new for the first time, they felt great. Whereas, when they're in a social environment, or they're in a class where everyone is at this level and they're the only one that's down here, and whether it's a trainer actually being quite controlling, or whether it's just something for individual people that they feel self-conscious and they feel like they're not good enough. Trying to work out how we can reduce those kind of things in the exercise world a little bit more is definitely a challenge, but it's also something that it could have great value if we work out how to tone down that sort of language just a little, so that, we're not harming one person at the expense of making, 9 others feel really good, for example.
So in this study that you're doing or in other studies, have you spoken to trainers and what they feel or how they feel about the whole no pain, no gain or the controlling style? Because I can imagine, I used to be a trainer and I can imagine, especially when I was first in the industry, you telling me this and I would have been like, well, no, I need to, push people. That's my job or whatever. So, yeah, have you spoken to them?
No, I haven't yet. I have a very long list of like want to do this one day kind of stuff stuck up on my wall, and that's one that's been on there for a little while. Is okay, what do people in this world? Why do they hold these messages, or where do these messages come from? And it's the same. There's personal trainer world, there's PE teacher world. I think we've tackled it in PE world a little bit more. But we haven't really done anything in exercise physiology or personal trainer kind of space. And it's been on my list for a little while. And I think the main reason for that is the same as what we said before about the psychologist perspective. Like, we as a physical activity and mental health research field, we need to be getting the right info to these different professions and careers and fields, so that, because they're the ones who are able to have the impact. We can do the research sitting here, and it's really important to inform these things, but unless we get those messages out to these different professions, they're the ones who have the capacity to change the way they're doing things and increase people's mental health benefit from exercise. And so as a field, they kind of started with psychologists first, okay, because in terms of severe mental health disorders or people who are in a position where they're actively seeking out support for a mental health reason, psychologists are the ones that have access to those people, and they're in a position where they're able to adjust what they're saying to reduce depression and anxiety and things like that, and that's great. But because I do more of the physical activity and mental health research as opposed to the preventing mental illnesses, and so from a broader population level, I'll sit here and think, okay, but it's personal trainers in gyms, and it's group fitness classes that run their boot camps on the Oval in local parks and things like that. These are the people that are engaging with everyday people all the time. So it's not just about getting that message to psychologists or exercise physiologists in mental health care settings, but it's actually about slowly changing the way that we do things or giving people guidance in general settings. Because if we can do that, then the number of people that are reached through every single gym and personal trainer that is out there. I think one thing that we want to do first is exactly as you said, actually talk to personal trainers about where these messages or pre-connotations come from, because you're exactly right. And in terms of that, but it's my job to get an outcome. And I think the more that we translate this sort of mental health benefits of physical activity into the real world, I think we'll tone that down a bit. And it's because I'm assuming that, a personal trainer has knowledge on physical health, and they have knowledge on exercise behaviors, and they've got knowledge on how to recommend certain thresholds and certain reps to progressively load something. And they've got all this knowledge on that physical part. And so, everyone wants to do their job well, and their job is to reach a certain weight or reach a certain load of something. And most people who are coming to a personal trainer as opposed to just sort of exercising on their own in a gym, they've probably got some physical goal that they're trying to achieve, and your job is to help them achieve it. And so it is really easy to get caught up in this, no pain, no gain, or you have to put in max effort 24/7. That's my assumption in terms of where that sort of language comes from with trainers. It'd be fascinating to actually do a project around that to better understand that, because people aren't going to personal trainers saying, I feel like crap, make me feel better. They're not going in and saying that. But I think if we can get this research out there a bit more, where people in that kind of position, like you were previously being a trainer, know that, oh, okay, I could help this person lose this number of kilos because that's what they're interested in. But if I do it in this way, they might get that benefit and feel really great about it as well. They might be more likely to continue exercise because it makes them feel good too. So I think talking to trainers about where those ideas come from and how they would feel if we suggested different ways about going about things is important, because we want to be working together so that they're receptive to the research that's coming out, but also making sure we're actually translating things and people know. I think that's going to be key, is that we need to make sure people in this sort of capacity understand that we're not saying, don't ever push anyone, and we're not saying, if you think they should do 2 minutes on a treadmill, only make them do one. We're not saying that you can't have any of that physical side of it. It is exercise, it is physical activity, that's always going to be there. But if we do things in a slightly different way, you can get the physical benefits and the mental health benefits. The mental health benefits don't prevent the physical benefits as well. So I think, making sure people understand that it's not one or the other, and working with, all of the people who work in this space, including personal trainers, is definitely something that would be really fascinating, to be honest, but also really important in terms of making sure we do, optimize the mental health benefits alongside the physical benefits. That's, really the key, I think.
I remember a few years ago, I came across self-determination theory, which I think when you said autonomy supportive, and I know you've done a lot of work in SDT, that kind of body of literature, but I was a trainer for a while, but also a psych student. And in my psych studies, I came across SDT, and that filtered over into my philosophy and just way of training people. So it became a lot more autonomy supportive. And I don't have data to support this, but I did feel like affectively the way that people experience my classes or my sessions was very different compared to the no pain, no gain when, you do support their autonomy. But the point I want to make is that when I tried to gently share this with other trainers at the gym that I was working at, it was a very cold experience. I found trainers can be very dogmatic and protective almost of their own philosophies and ways of training. So I'm very curious to see how you go.
You might have just pushed that little thing on my list over there of things I want to do. You might have just helped push it up a few notches and get it closer to the top of that list, because it is really, really fascinating. And hearing the response that you've got from people when you're going to them as a personal trainer saying, I did this, and you've gotten that response. So, as researchers going in saying this, we're going to get the same response, only even stronger possibly, but you've still got that even being on the same playing field as them. But I think something that's easy to keep in mind is that, none of this is a criticism of personal trainers in any way. I think what we need to remember, though, is that a lot of the time personal trainers are probably people who love exercise, or they're people who have excelled at doing exercise for a really long time, and therefore they're really passionate about it. And so it's not wrong for them to, have the feelings towards exercise prescription that they do, because that's what's worked for them. And it's the same as what we were saying before about, social media influencers. They're not in the wrong for having those feelings. They're just sharing something that made them feel good. And, that's a good thing. But what we've got to remember is that, personal trainers probably don't reflect the average human being population. And a lot of the time, people who are going to a personal trainer are people who don't have a lot of exercise background, or they're going because they don't know what to do and how to do things safely. And they're probably quite different to the people that have a career in being a personal trainer. So it's understandable why they have those feelings they do, and that's worked for them. And it's, it's made them feel really good because they keep achieving these great things. But it doesn't necessarily mean that that's what's going to work for someone else. And, maybe there's a lot of work to do in that area. And maybe we need to, until people like yourself, you've actually experienced, training in two different ways, and you've seen the different value that's come back. And, for me, I don't have that kind of role. The project I did last year, I designed the exercise sessions in line with self-determination theory. I designed the way that we had different choices and activities. And so, there might have been 10 activities written up on the board, and it was like, okay, you need to do 6 of these. You choose the 6, you choose the order. And so, sharing real practical examples like that with, the personal trainer exercise sort of industry and world, so that they can see we're not saying, just give people a chance to sit down and do nothing. We're not really saying that, because we want them engaged in exercise. But something as little as that, I was even surprised how important that was to people, because, people was, they were saying to me that, they like getting 2 choices, because if they're not feeling it today, or something's happened, it's been a really stressful day, or they're just feeling really tired and it's been one of those days at work, then, instead of aiming for the top level and feeling bad about not achieving it, I'll aim for the lower level, because I know today's not my best day to shine, and that's okay. And then, once I get into it, I probably start feeling better and I start aiming for the higher level as I go. But because they have that ownership over what they're choosing, they're coming out feeling great about what they've done, and they've done something for themselves as opposed to just doing this generic thing that they're being told to do. And I think there's a lot of value to the choices that people get, because that's what makes them feel like this is for me. I'm actually choosing to do something good for me. I'm picking what works for me. I'm picking what's going to make me feel good today. And then that gives people that, that runner's high afterwards. It's not about, a runner's high because you've pushed to your max level, but it's about feeling good about what you've done for yourself during that session. And, when we had the, here's the 5 exercises, you choose the order that you do them in. People were saying even just the littlest things like, I did this yesterday, so I know that my legs are tighter than the other parts of, my body, and I'm going to put it in an order that I know is going to make me feel good because that'll come easier after that. Or it was just giving people that sense of achievement and satisfaction. And I think sharing some of those ideas with personal trainers where we can help them to see that we're not saying tone it down in terms of don't ever push anyone, or don't expect them to do the whole 5 exercises still, but little ways that you can adjust things to give people that ownership over the behavior that they're doing. That ties back nicely too to where we started talking about, about medicine. Imagine if you could say, take this pill and this one, and you choose which one makes you feel better about taking it. You're still getting the same dose. You're still getting that same prescription. You're still doing the behavior, but it gives people a bit of that like sense of pride when they walk out going like, I didn't just do it because I was told to, but I actually chose to do something really hard because I can do hard things. And therefore they're walking out with that sense of achievement, and that's giving people that confidence booster. And, so this project that we did last year that was really tied around both mental health and motivation at the same time. And I said, so, week 10 compared to week 1, what was it that was, what made you come back the next week? And what's fascinating is that the mental health outcomes of physical activity, for a lot of people, that's what's actually driving them to come back. People that have got a weight loss target or a certain, or are really involved in heavy training schedules and they've got physical targets, that's great. But they're going to keep doing that anyway. We know that they like it. So I think for people that aren't that active, once they had a few experiences where they were like, oh, I felt really good after that because I felt so proud of myself. That sense of pride and achievement, that's what actually, encourages people to be active longer term and makes them come back. So probably, doing a better job of actually highlighting to people in that position that the experience that you've had where you've done things 2 different ways and you've seen the value of doing it that way. Until you really see that value, it's completely understandable why people are like, nope, got to push them. That's my job. And if we help people to see that, yep, that is your job and that's okay. But as a side note, if you could also make people feel really great at the same time that they're there, then, it's a win-win really.
No, that's very exciting what you're doing. And I think it sounds like it'll have a pretty profound impact on trainers and instructors to have, the knowledge that you're able to share with them, but also that's going to filter down to potentially, thousands and tens of thousands of people who are their clients and attending their classes and sessions, etc. So yeah, you've done a lot of work which fascinated me on looking at what particular variables may or may not influence the mental health outcomes of physical activity and exercise. So I'd love to dive into that because, again, I think I said this at the top of the show, but a lot of people listening will be really tuning in for that and looking as to how they can harness or optimize their exercise routine accordingly. So if we start with type of exercise, so kind of, I don't know, to put it into 2 camps, like the weights, strength, resistance training versus the more aerobic cardio based exercise, what's better for mental health, if any?
Okay. So I think in terms of those variables that influence, the mental health benefits of physical activity, the type of exercise is probably one of the areas that we've looked at the most. That's probably where research started going after the intensity and duration type stuff. And it's one of those answers that's not a clear answer because every study seems to have sort of different findings and we don't have any real consistency. And I think the reason for that is that it does probably come back to what people enjoy more. So there is a ton of research showing that, aerobic physical activities are good for mental health, which is great. But there's also a ton of research showing that more resistance-based activities are also good for mental health. And so that's a great thing because it means they both seem to be good. Neither of them seem to be detrimental in any way, and we don't need to sort of steer people in one direction or the other. But they seem to have kind of different benefits for different people. So I think one of the real values of resistance training is that there's small, discrete activities that you do. So if you're doing something, whether it's body weight or with an actual weight, it's really easy to see small improvements. And so a lot of people have always commented back in the research that I've done saying things like, oh, like I only did like one extra weight or one extra rep of something. And that's enough to, walk out on that high because I've done something better than I've ever done it before. And you could possibly get that same kind of experience for, something like running if you run a certain distance in a lower time. So it's not to say that resistance training is better, but some people do kind of talk about this because it's so measurable and there's so many discrete little improvements that you can make that, or even, feeling physically tired, the muscle that you've worked feeling tired kind of gives people feedback that like, oh, you did something really good for yourself. So resistance training does seem to bring in a little bit more of that benefit. But it's also, I think the hard thing with mental health is that there's a ton of different emotions. There's things like improving pride and confidence, and there's things like helping people feel more relaxed, and there's energetic and relaxed are two completely opposite things, but they're both great and they're both good and they're both parts of mental health. So one thing particularly about walking and swimming is that a lot of people have said they feel more relaxed after a walk or a swim, whereas they come out of the gym doing resistance training and they feel more confident and have higher self-esteem and feel that higher sense of pride. So I think doing that, the type of research that I'm doing at the moment, where we're looking at this stuff qualitatively with lots of people mapping things out, is that it's not just one type is better than the other, but it's maybe starting to understand why different types are better, because then people can choose what they want. Some people might really need that spark of confidence. I went to the gym this morning before I jumped on the podcast. I was like, nope, today's the day that I want to go to the gym. I want to, start my day off on a high before I come into work and do something like this. Other days at work are really stressful, and I know that I'm going to feel better going for a swim after work. And that's something that I didn't even notice myself until I did this research, and I had all these people saying like, oh, I feel really relaxed after a swim and I feel really confident after the gym. And I was like, interesting. Okay, so that, one's aerobic, one's resistance, but it's not really that one is better than the other. It's just that different things lead to different, emotions, but they're both part of mental health and they're both really good for people.
So you alluded to it there, time of day, does that make an influence, or does that have an influence rather on the mental health outcomes?
Yeah, so I don't think there's a clear answer in terms of like, okay, if I train at this time, I'm going to feel the best. I don't think we're ever going to really have that kind of guidance in terms of an optimal time. But I think it does come back to what it is people want to get out of it, because what we've noticed is that a few years ago, I did one study where we measured how people felt right before and after a gym session. And it wasn't a certain program. There was nothing dictated about how long the session was, or it was just people turning up to the gym. How do you feel right now? They went to the gym, answered a few questions about what exercise they did, who they did it with, are you exercising before or after your work day, or, is this a break at lunchtime? And then they sort of reported how they felt after their session. And what was really interesting is that people who were going to the gym before and after either work or study, there was an increase in like mood or affect or how people feel. That's kind of the way that we measure that. So there was an increase from before to after the exercise session. But when we split up the exercise sessions into 3 different groups, and we had before work, after work, and in the middle of the day, we saw that increase in mood for people before and after the day, but not the people who were exercising in the middle of the day. And I think we don't know a lot about this, but I think that would tie back to that mechanism about distraction. And, if you're doing exercise in the morning, it's something for you, or if you're doing exercise after work, it's after work, and it might be a good distraction from stress. But if you're kind of quickly running in your half an hour lunch break and you're still like mentally in work, perhaps exercise in the middle of the day doesn't distract you as much. And so that's that's not to say that, people shouldn't do that. Some people might just be squeezing in physical activity at the time that they can do it. They've got a hectic life at home with young kids and they know that that's their one shot. And so it's not to deter people from exercising in their lunch break if that's a good thing for them. But that little finding there, I think, gave me enough to go, okay, we need to go dive deeper into the time of day. And when I did the next project that was qualitative with actually, people's detailed responses about how they feel in different physical activity contexts, that's when I could kind of dive deeper and ask more questions around, how do you feel? Why are you doing this behavior? And what we then noticed was that exercise in the morning seemed to be kind of associated with this sense of routine and this sense of like accomplishment, because it was like, I've started my day off doing something good for me, and the day's starting on a high, and this is my routine and it's what I do. And because I can stick to a routine, I feel less chaotic and I feel like, I've got my life in order and I'm feeling good about how I'm doing. And that's really cool. But all the people who were talking about experiences of exercise in the evening, they were saying things like, oh, it's really good because it gave me this concrete barrier between work and home. And so it made it easier for me to leave job stress at work, or it made it easier for me, even if I'm not stressed about work, it made it easier for me to really be present when I got home and, talk to my family and my kids and my wife and cook dinner. And all of these simple everyday behaviors were just easier because I had this break and it swapped me from work mode to family mode. And that made the rest of my evening more relaxed because I was in a different headspace. So the time of day, it might not come back to the time actually, whether it's 9 o'clock or 10 o'clock. But, little things like that could be what we're giving, psychologists down the track in terms of talking through this stuff. Because if a psychologist is working through things with a client that they've, had a number of sessions with, they know what position this person's in, and they know whether they have difficulty in relaxing and switching off, or they'll know whether this person has really low self-esteem, and they might be able to so it's really hard to put concrete rules around when you should do it and what type. But understanding how different behaviors lead to these different outcomes, even though they're both good outcomes, can help us to kind of recommend a better activity for different people, which is really cool.
Yeah, I love that. Like that personalized kind of intervention, almost just personalizing it to you based on your goals, based on your individual differences. So what about duration? Is there a minimum effective dosage of exercise?
Not really. So what we see in the literature is that, we see statements such as, as little as 20 minutes is good for people. And we see, even once a week is still good for people. So I think that's really good because it doesn't deter people who might be inactive from starting, because we're not saying you got to be active every day. Ideal case scenario, people would be active to some degree every day because that's important for physical health as a starting point. But in terms of mental health, even going from no days a week to 1 day a week seems to have an increase in these great outcomes. And, as little as 20-minute walk improves mood as well. So that's a good thing. Typically what we see is that it's not about a certain number of minutes or a certain number of days, but rather people who are regularly active tend to have better mental health and well-being. So it's more about that long-term regularly being active to some degree. It might be once a week, but it might be every week, as opposed to the random sporadic, New Year's goals kind of, I'm going to be really active this week and then not at all for the next month. The people who seem to have some type of regular activity within their week or their month tend to have sort of higher reported mental health. So I think that's really helpful in terms of personal trainers and things like that, because rather than, having to do a lot, doing a little bit, but doing it consistently is probably what's going to be more important.
And I think it's empowering for a lot of people as well to know they don't have to be pounding a treadmill or lifting weights, whatever, for hours on end to get, the benefits. Like you said, you can see, I think you said even going from 0 to 1 day a week, right? You can see a meaningful impact.
Yeah. And so I think that's another area of, research that we haven't done a lot with, that we could, talking to personal trainers about their views and why they have the views they do, and, why they push to the degree they do is one thing, but also it'd be so interesting to do more research with the general population around, what do you picture when you hear the word exercise? because everyone pictures different things, and that's okay. But if we're specifically looking to increase physical activity among people with depression, or we're specifically looking at increasing physical activity among people that are currently inactive, better understanding what they actually see or picture. Do they picture it being running on a treadmill and being pushed to run faster and faster and faster? What image do they have in mind when you say physical activity? Because it could be a fighting battle to some degree if we're picturing exercise in this, fantastic walk around the river with a cup of coffee, talk to your friends kind of way, and we're saying do physical activity, it's good, but they're kind of picturing something that's really different to what we, know physical activity can be, then, that's going to really limit how much of an impact we can have. So that's also, a really interesting area of something we could do down the track, better understanding what people picture or see physical activity as including.
And one of the more concrete findings, at least it appeared more concrete to me, was the domain of physical activity seems to have quite a big impact on the mental health outcomes. Can you talk us through, the importance of that? Because to be honest, prior to reading your research, I wouldn't have really have even considered that.
Yeah, so that was one of the starting places for me. So I was like, all right, physical activity seems to be good for mental health. That's awesome. But what do we do with this? And for me, when I first started research, I really imagined, okay, we know physical activity is good for mental health. Brilliant. If someone came, I've been reading this literature for, a month or two solid, just reading everything that's out there. And, if someone came to me tomorrow and said, cool, I really want to do physical activity to help with depression or to help me have increased self-esteem, what do I do? And, I remember talking about this with my supervisor and I said, I don't know what the answer is. I've been reading this literature for months and I don't know what that answer is. So trying to work out that answer is sort of where I initially started. And the first thing I did was have a look at the different physical activity domains. So all we mean by domains is different life domains, different aspects of your daily or weekly life that could have physical activity in it. And so I'd seen a little bit of research by one of my colleagues now at the time. This was when I was first a student starting to do this in, the same position you are. And I remember reading this work that showed that leisure time physical activity seemed to be a bit better than some of the other domains. And so all that means is physical activity that's within, our own free time. And that physical activity seemed to be better specifically for symptoms of depression compared to work physical activity, so physical activity that's part of your job, or transport physical activity. So, a method of transporting from one place to another, or the other part of physical activity could be sort of house-based physical activity. So it could be mowing the lawn and vacuuming, it could be playing with the kids, those kind of things. And so that initial little bit of research from one of my colleagues that showed that the leisure time seemed to be best was really interesting, but we didn't have a lot at the time. It was kind of, only women or only depression as the only outcome. So that was one of the first things I did, was to sort of was a systematic review, which is bringing together all of the studies that we have in this area so far to bring together everything on domain. And so that showed us that leisure time physical activity was the only physical activity domain that was associated with increased mental health, but also associated with decreased mental illness. But what we also know is that we've got far more research on that leisure time physical activity. And so that's really cool to know, that was sort of finding number one, was, okay, physical activity during leisure time seems best. Okay, that's great. And that doesn't mean that, people who have active jobs or people who are walking around a lot at home looking after kids and vacuuming and doing housework, it doesn't mean that those behaviors are necessarily bad for those people. But it does think about how we're promoting physical activity, because in the physical activity promotion world, we say things all the time like, do more steps, or, do a squat while you're waiting for the microwave to cook something. Or we have these slogans that make it sound like physical activity is so easy, just move more, and that's it. And I think that's really great because it's really empowering and it tells people moving more is great, which is true. But when we were looking specifically at mental health, that, simply standing up at work or simply vacuuming twice as often isn't necessarily going to be what increases mental health the most. So it's okay to be active in those other domains. That's not a bad thing. But it did give us that starting point about going, okay, physical activity within people's own free time seems to be the best. Okay, so why might that be the case? And, I think from there, we've now gone further down this, okay, if physical activity during people's own time is better than simply walking or moving in these other domains, then why is it that physical activity is really good? Which has then kind of led its way into looking at time of day and types of activities and resistance versus swimming and things like that, and social interaction and who you're talking with when you're active and things like that. So at the moment, one of the most concrete pieces of evidence we have is that, we'd want to recommend physical activity in people's free time. And I think that's really important too, because a lot of people anecdotally have always said things like, oh, I used to sit around heaps and I used to go for work and I used to go to the gym, but now I have a really active job, so I don't go to the gym anymore because I don't need to. And from a physical health steps-based perspective, that's fine. But if someone were coming to a psychologist, for example, with a particular challenge, then we wouldn't want the psychologist to be like, oh, you're really active, I'm not going to recommend exercise, because they might be really active, but there could be that one extra behavior once a week that they could do for their own mental health and well-being that has value beyond simply, doing the vacuum, looking after the kids, walking around at work and that kind of thing.
Oh, I wonder how much like choice and autonomy has to play in this in terms of underlying this. Like, if you're exercising in your leisure time, typically it'd be done out of volition, right? Whereas if you're, like you said, in a high activity job, that exercise itself is less volitional, it feels.
Yeah, definitely. And there's still going to be various levels of choice and autonomy and volition within leisure time, because we still, oh, my friend was joining this OzTag team and they needed an extra person, so I went and joined it. And there's still, personal trainer made me do this. So there's still elements of variation within that volition within leisure time. But I think at the end of the day, there is more choice over the actual behavior itself. So, we could still change the way that we're running sport sessions or the way that we're running personal training sessions, and we can still bring more choice into some of those things. But there is an element of engaging in a behavior. And I think if we look at physical activity in that way, where these are experiences that people are choosing to some degree to engage in, it steers us again further away from that neurobiological perspective and more into these are actual experiences that people seek out and can use for well-being benefits. There's a very big, physiologically, walking a lap around work for an hour, vacuuming for an hour, mowing the lawn for an hour, and going to the gym or going for a swim or going for a walk around the river with your friend, they're all the same thing in terms of movement. And that's the way that we typically view physical activity from a physical world, where we're looking at it in terms of steps and movement. But I think shifting it into more of this psychological, social, like physical activity behaviors are experiences that we can use to harness good things out of. And the more we start to do more of this qualitative research and understanding how people experience these behaviors and the meanings that they attach to them, we'll kind of start to understand how to use this a bit more, as opposed to just focusing on steps and minutes and saying, walk more and that kind of thing. So, yeah.
There's so much value there in terms of those variables that you've discussed. And it sounds like there's going to be a lot more with your research, these future projects. I'm excited to see what they have in store. I think finally that you wanted to share with listeners, any kind of pieces of advice or anything, you wanted to share?
I mean, it's hard to kind of, cap it into one thing, because, different things resonate with different people, whether it's, someone listening thinking, oh, okay, what activity should I do? Or whether it's a personal trainer listening who's, heard your experience of the two different ways of training. The messages is different for different people. But I think the main thing is that, we're not viewing physical activity as this like, it doesn't count unless you do 30 minutes. Well, it does count. If you can only fit 20 minutes in at the gym, that's still a good thing. And, it does count if it's a light intensity activity. If, a friend says, we're, two young mums are really busy and don't have a lot of time to catch up, but hey, we can, take the kids for a walk around a park or something, that is physical activity. And if that's going to make you feel good, then, we shouldn't feel guilty about doing active behaviors that are good for us just because they're not a high intensity, or they're not in a gym, or they're not having someone yelling at you. If something is active to some degree and you're moving and it makes you feel good, then, that's a good thing. We shouldn't be feeling bad about that, or we shouldn't be kind of, preventing people from doing those things just to try and get them to do something that's harder or that's more intense. So I think in terms of, the general community that might be listening, if they are trying to be active, I think, giving yourself a minute to sit down and think about what activity you might enjoy. Because, if you are picturing, oh, I need, a lot of people say all the time, I've got to join the gym. And, you don't have to join a gym to be active. If you feel like a personal trainer is going to work for you because you want someone to show you what to do and learn, then that's fantastic. But, if you don't have the finances to join a gym, or you feel like you're going to be a bit embarrassed and nervous in a group class, or, then don't pressure ourselves to kind of have to do these really exercisey things. And, at the end of the day, if you're being active and it makes you feel good, then that's a fantastic thing for people's mental health and well-being. And that's what we really want to understand a bit more and promote a bit more, is, doing active behaviors that make people feel good, as opposed to, taking that exercise prescription that's hard work sometimes.
No, thank you for sharing that and for all the wisdom and advice that you've shared today. I think the research you're doing is, so valuable. And I think it's been a very practical conversation where people listening, I think most people listening, will either exercise or have a want to exercise. And I think everyone who falls into either of those buckets is going to benefit greatly. So thank you, Rhiannon.
Not a problem at all. I'm more than happy to talk about this stuff. It's really interesting. It's great to have a chance to talk to you about it, and to talk to everyday people. And, I sit in my office and do my research, and my four walls listen to me most of the time. So it's really fantastic to be able to actually have a chat to everyone and kind of, share what we do and help get that, that message out there for now, in terms of, activities supposed to be fun to some degree. If you enjoy something, keep going.
And that was the benefits of exercise for mental health with Dr. Rhiannon White. That was an awesome conversation, very steeped in practicalities, but also steeped in evidence, and I hope useful and practical strategies for people listening to be able to now go and implement. I think the biggest takeaway for me was the importance of making exercise work for you with your own lifestyle in order to increase adherence. I think that's a huge factor that was a theme in my conversation with Rhiannon, that ultimately leads to sustainability and ultimately leads to really unlocking the powers of exercise for mental health. If you have any questions about some of the content covered today, Rhiannon has very kindly offered to answer any questions, so please shoot them below in the comments and I can send them through to Rhiannon. Otherwise, if today's episode offered you value, I would be so grateful if you hit subscribe or shared the episode with a friend, as this is how I continue to grow the Mental Wellbeing Show and communicate evidence-based mental wellbeing strategies out to the broader community. Stay tuned for next week's episode with Professor Christina Lerman on how social media is affecting our beliefs, values, and mental well-being. That'll be dropping next Tuesday, Australia time. That's it for now. Thanks so much for listening, and I'll see you all next Tuesday.